I'm Dr. Srinivasan Paramasivam, neurosurgeon and neuroendovascular surgeon at Apollo Main Hospital, Greaves Road, Chennai. Today I'm going to talk to you briefly about stroke, acute stroke. Acute stroke means dysfunction of the brain because of either lack of blood supply or bleeding in and around the brain. So whenever there is a vascular event happening in the brain loses its function immediately. And one important disease for which the treatment has transformed in the last 2 decades is acute stroke caused by occlusion of the vessel, that is cutoff of blood supply to the brain that happens acutely, and that is, we call it as ischemic stroke. And this is the majority of the strokes, which constitute about 80% of all strokes. And today we are able to treat them effectively. And this treatment was not available about 20 years ago, and today we can treat them if they come early to the hospital. That is, within the first 4.5 hours if they come, we can treat them with intravenous drugs, that is thrombolytic therapy we call it. If they come later, we can still treat them up to 24 hours with what we call it as mechanical thrombectomy. That is, we go inside the blood vessel, we remove the clot from inside the blood vessel by doing thrombectomy, and we restore blood supply to the brain, and the brain starts to function again. And generally the misconception about stroke is it is a painless disease. When they have a stroke, nothing more can be done. Usually if they identify the signs of stroke like facial deviation, inability to use the arm, or difficulty in speaking or understanding speech, and they come to the hospital on time, there is hope and we can treat them effectively. And after treatment, if they have some little residual deficit, they can still be treated effectively by proper rehabilitation to put them back into their normal life, into their normal circumstances, and they can start functioning again. So the message today is stroke can be treated up to 24 hours, and even after the stroke hits, there is hope with treatment and rehabilitation. Thank you.